Where I can dedicate my time, my years just for the boy. Why? Because I don't know why I always had this in my mind. Probably because I was also a teacher and I was seeing children in the secondary school. I had this
Right.
mind, no, no, no. I don't want my later age, my later years to be miserable if I don't train him now. I don't know why I always had that in my mind. Probably the students, the kind of students that I had in the secondary school, I was teaching that. Looking at them, probably I had that kind of, I must prepare him. I must do something so that he can be independent. He can do things by himself, and things like that.
Mm, mm,
So there
mm,
was one therapist. She was a behavior therapist for my boy. She was the
mm.
one who actually helped me to.
This podcast shares personal stories and professional insights, but it's not a substitute for medical advice or therapy. If you're looking for support, do speak to someone qualified and trained in child development or special needs care. You'll find the full disclaimer on the screen and in the show note.
Hi, welcome to a new episode of Adapting Together, a podcast to empower, support, and inspire parents and caregivers of children with neurodivergent needs. I'm Sini. I'm co-hosting this episode together with Kevin and Carmen. Hi. As a BCBA, I have the privilege to work alongside with many families in choosing a right school for their child. So a school is not only about just academics. It is a place that gives emotional safety. Like say, for example, know whether the child feels safe in a school or not, whether this place he feels belongings or not. And it is also a place to build confidence, relationships, like friendships, independence. So, and for any children, the right support can completely shape how they experience learning and how they see themselves, right? And choosing a school can already feel overwhelming for any parents. But for parents with children with autism, it often comes with even more questions, more uncertainty and emotions, right? Like say, for example, question like going to mainstream or special ed, inclusive setting or small support environment, question like that, or will the child be understood? And also knowing what support actually exists out there in Malaysia education. So today, we are really excited to be joined by Dr. Shyielathy. Dr. Shy is an academic lecturer under the Department of Postgraduate Study in an institute in Ipoh. So today, we really wanted to create a conversation that is practical and hopeful with Doctor. Welcome to the show, Doctor. We are so
Thank
happy that
you.
you can join us today. So today we really want to create a conversation that helps parents to better understand some of the schooling pathway available under the Ministry of Education of Malaysia, or what support system are out there, and also how family can actually navigate this journey with more confidence. So let's begin. So to start us off, Doctor, can you introduce yourself to our audience in terms of your professional background? Yes.
Thank you for inviting me for this. I'm sure it's going to be very exciting to
Mm,
talk about, to chat, a topic that is I'm very passionate about.
mm,
I'm Shyielathy. You can call me Shy. I was a special education teacher for the last 15 years. I worked with, I was attached to the government, to the Ministry of Education. I worked with preschool children. My first posting was in a preschool for children with visual impairment, and then moved to secondary school for visual impairment, and then I worked in special education integrated program, secondary school, with students with learning difficulties.
mm.
I also worked with Form 6 students with visual impairment for inclusion. So about 15 years in the field. And then I moved to Institute of Teacher Education, Institute Pendidikan Guru, to train the pre-service teachers.
Uh,
So now I'm currently still in the same institution, Institute of Teacher Education. It is under Ministry of Education. But I'm in charge of this postgraduate department, teachers who would want to come and do masters. So we offer
Mm.
masters in pedagogy. So that's a little bit about myself. And I'm also a parent, a mother of a child with special needs. He is about 16 now. He has autism, my boy. So I think my, not only coming from being a teacher, but also a parent. And I always tell my students, my other the parents who ask me that, I see not only my boy, I see many, many children. My experience is not just from my boy. So based
Mm.
on that, I give my opinion.
Yeah.
So that's a little bit about me.
I'm seeing doctor wearing so many different hats as a mother, as a teacher for young students, up until now master's level teachers who wants to pursue in this field too.
Yeah.
So achieved. Right.
Teacher for the teachers.
Yes, correct. Teachers for the teachers. Yeah. All right. So to start us off, right, doctor, can you also give an overview of the schooling options available under the Ministry of Education for children in the spectrum?
Under Ministry of Education,
Mm.
we have three schooling options. Okay, or we say programs lah. One is learning difficulties, masalah pembelajaran. Then the other one is Sekolah Pendidikan Khas, special education school. Then the third program is inclusion program, Sekolah Inclusive. So these are the three types of program Ministry of Education offer for students with special needs. I cannot use the term autism alone. I cannot use the category autism alone because in our Ministry of Education, we don't have one program specifically for each category.
I see.
Children are grouped together under programs according to their functional level. We call kefungsian. So they are grouped together according to their functional level in classes, not based on their category. So we have three. Sekolah masalah pembelajaran, special learning difficulties, then sekolah pendidikan khas, then inclusion. Now, who goes to masalah pembelajaran, learning difficulties? Children under the category of autism, ADD, ADHD, syndrome Down, other intellectual difficulties, physical disabilities, hearing impairment, they all go to masalah pembelajaran. Okay. Some schools, they have SEIP program or Special Education Integrated Program, or in Malay, we call PPKI. Some schools, they have PPKI program for hearing and visual also. Some schools. Whereas the Sekolah Pendidikan Khas means it is a school by itself for visual impairment and for hearing impairment. That is Sekolah Pendidikan Khas, special education school. It's a school by itself.
I see.
Inclusion means special education students who are able to cope up cognitively with the academics, with the mainstream syllabus, then they will be placed in the mainstream classes. These three programs we have for preschool children, we have for primary school children, we have for secondary school children. And especially this PPKI, Program Pendidikan Khas Integrasi, PPKI or SEIP, Special Education Integrated Program. I mentioned just now, categories are autism, ADD, ADHD. This program, we have it in most of the primary and secondary school in Malaysia. Like, it is integrated into the mainstream, but we have a special building. We have a separate administrator. We will have a senior assistant teacher separately to take charge of the SEIP program or the PPK.
See, sounds like a very complete coverage or support at each of the level.
Yes, correct. It is quite complete. Like I said, starting for PPKI especially, we have from preschool to primary to secondary. We have primary, we have preschool PPKI, we have primary PPKI, we have secondary PPKI. And who goes to the inclusion? The students from the PPKI will be selected to go to the inclusion.
So most of the time will be the level 1 or slightly level 2, maybe from the spectrum. Is it?
We have some criteria. I mean, Kaman, are you trying to ask me who goes to inclusion?
Yes. Like a PPKI, who has a chance to go into the inclusion setting?
Selection criteria.
It's like this actually. When we receive students, it's the first enrollment, whether standard 1 or Form 1 or preschool. Actually, inclusion is across all the stream, but it is a bit less in preschool. It is a bit less because the more inclusion is done in primary and secondary. PPKI, preschool, although yes, we can, but the number is quite less because probably we need to train them more. You see? So, when we receive students first enrollment, standard 1 or Form 1, okay, what we'll do is we will do an assessment. There will be an academic assessment. Academic assessment means can read, can write, okay, can follow instruction. Can read and can write, lah. That's mainly for academic. And there will be a behavior assessment. When it is behavior assessment, we see whether they can follow instruction. Can speak or very minimal speech, that doesn't matter, but can they follow instruction? Can their behavior is conditioned? You see, that means there's no aggressive behavior, no disruptive behavior. Basically, the child the behavior is conditioned, toilet trained. Toilet trained. Okay. So if they have passed all these academic and also behavior screening, okay, then what we will do, we will give them 1 month time in the PPKI to train them. The PPKI teachers will train them, prepare them for the mainstream class. Okay, prepare them. By then, we will discuss with the mainstream which class we want to place this child. If I means, I would always request for not the very pandai class and not the very bad class. I would request for the intermediate, moderate class in the mainstream. Okay, so that we don't want the child to be feeling under challenge, and we also don't want the child to feel overly challenged. So I will request for somewhere in between, moderate. Okay? Discipline also, the mainstream classes also, we have discipline problem and all, right? So the class must be quite a conditioned class as well. So after discussing with the mainstream teachers, with the academic senior assistant in the mainstream, and then looking into the class teachers and everything, after 1 month training in SEIP or PPK, okay, we will start with partial inclusion first. There will be one person called special or resource teacher from the PPKI. The teacher is elected lah, dilantik lah. She will be following the child to the mainstream. Okay, to condition the child, to help the child out in the mainstream class until the mainstream teacher is able to cope up with the child. So there will be also a 3-month probation period for the child to be in the mainstream.
Okay.
And sometimes we also have PPM. PPM means Pembantu Pengurus Murid. Okay, the PPM we will also in charge the PPM to be with the child if it is necessary. And then we also do programs like peer support. As soon as we include the child in the classroom, we find a buddy for the child. We request for special privilege, like put the child in front table, and then place another child whom we feel the buddy can really support. And then we follow the child to the school, to the canteen, to the toilet, to the library. So another 1 month of training in the mainstream. And then gradually the resource teacher will come forward.
Okay.
She will
So
pay down.
so this is the one that actually have the chance of going to mainstream. That's pretty clear, and there are criteria to be met in order to go into mainstream. So how about the one that is not able to fulfill these few criteria? And I know that government now is saying there's a 0 rejection for our student. Yeah, maybe Dr. Shai can share a little bit more, maybe on the preschool, when they face this
children that is not, have a lot of challenging behavior and etc. How is the arrangement will be like? Yeah.
Remember, I mentioned just now the assessment that we will do.
Yeah.
Actually, we
Yeah.
will do the assessment to everyone, not selected, at all the enrollment. Whether we have 20 number of enrollment, 30, we'll give the assessment to everyone, all the children. From there, we will screen them into 3 categories. The first one, ready for inclusion. The second category, ready for PPKI. The third category, probably we will suggest them to go to PDK, maybe because due to their behavioral challenges, whereby our teachers, it is not within our capacity. We must understand in our education system, teachers, all teachers, including me, we are trained pedagogically. We are not therapists. You see, we are not supposed to do any intervention. We were not given any training to do intervention to the child. We are trained pedagogically. We master the curriculum. So our duty is to deliver the curriculum. So minor behavior challenges we can handle. But if the behavior challenges are major and we are not able to handle the child, then the third category is we will suggest to the parents, place the child in PDK for about 3 to 6 months, intervene the behavior and bring the child back to the PPKI program.
PDK is EIP? Is PDK stand for?
Pusat dalam community, PDK, the JKM one, under JKM.
Okay,
PDK.
PDK. Yeah.
PDK, they focus more on therapy, on behavior, on self-help skills.
Yeah.
You see?
You reminded me so much of this vocab that I've learned in together with you. Yes. Yeah. So that is actually we have this PDK, which actually we heard like Selangor. We also have the Selangor
We had many
JKM.
common actually.
Many,
Many.
yeah.
Every day, the full day, in Malaysia, all over Malaysia.
Okay.
But again, if the parents say, no, I'm not keen in my child, then teachers, we also cannot do anything. We have to accept the child. But there will be a lot of challenges. There will be a lot of challenges from our side,
Yeah.
whereby, that's why, like I said just now, we are not trained. We are trained pedagogically. We are trained for pedagogical instructions. See? So to deliver the lesson and to intervene the behavior, it is not so possible for teachers. So when the child's behavior is at least 30% conditioned, then we can continue with the academic part of it, lesson. Academic, I'm not really talking about writing or reading, I'm not talking about we are preparing them for public examination. No, I'm in PPK. Yeah? We're talking about how to make them independent learning, independently, how they can socialize, how can they go to the canteen on their own, how can they function in this world, to their maximum independence. And along the way, we would teach them skills. We have skill subjects. So for that, we cannot be getting entangled with the children's severe behavior problems. See, so that's the reason why we suggest the parents bring them to PDK, condition the behavior, and come back to us. Anytime you can come to us, and we will continue from where we left.
Familiar with PDK then? Are you familiar with what is
I
the?
am not familiar
Not
with
so?
PDK
Because
because
it's different,
our
right?
ministry teachers, PDK teachers are not from ministry.
They are JKM.
They are not. They don't come under the teachers training.
Then I just wonder who are these people that is in PDK
They
that's
have got their
handling?
own module, Carmen. They have got their own module conducted by the JKM. And in PDK, they don't focus on academy. They are more on independence, self, behavior.
Okay.
Some PDK, they are very lavish. They are very, very established. They have therapy sessions as well. Mostly, they focus on, how do I say, entrepreneurship, sustainability. PDK starts from early intervention up to adulthood. They also have skills. They also have older special needs people in PDK. Mm.
Okay. Suddenly, so many things. Feel like Kevin have something. Wanna ask?
No, you are just passing to me to have something.
And another thing I forgot to mention,
Okay.
the schooling years, the schooling years
Mm.
in PPTI. Okay, for primary, you can be in the primary school until 14 years old. You can be in the
Mm.
secondary school until 19 years old.
Okay.
Mm.
So if it
Okay.
is
2 years.
preschool, you can delay up to 7 years old. Then standard one, you can come to standard one at 8 years old if it is necessary. If it is necessary. Otherwise, they can enroll 7 years old. They can enroll in standard one
Mm.
for PPK. But when it comes to primary, usually we will suggest them by 13 years old, send them to the secondary school. Don't keep
Mm.
the children in the primary PPKI too long until 14 years old, unless
Mm.
the behavior issues are quite severe, unless the maturity, the child needs to be there in the PPKI rendah yet, PPKI primary still, and then okay.
Mm.
But if the child is ready, quickly 13 years old, send the child to secondary because secondary program focus a lot on skill. They've got so
Mm.
many skill-based subjects in secondary.
Mm.
So the
Mm.
more we delay, the more late we will train the child. Like they have got
Okay.
subjects like laundry, car wash, subjects on crafts. We have got subjects on reflexology. They've got modules, all these.
Mm.
So the more we delay for secondary, the
The less things they can.
not many years we have.
So yeah. Okay, for secondary, there's so many different skill base that they can learn. Is it go across all different school? They have it,
Yes,
or is that
different school. At least each school they have got about 3 options. School can choose bakery, car wash, or laundry. They can choose. There's about I think around 10 options, skill subject options. So schools can choose. Minimum they must choose 2 options. So based on the options that they have choose, the government will provide the facilities. Say, government, the school chose bakery. So the government, Kevin, they will build a kitchen for us with complete set of oven, not the biasa oven, not the oven that we have in the house, it's a
it's
factory kind
proper
of
like the
oven.
proper
Yes,
kitchen
yes.
type? Yeah.
And 1 or 2 teachers will be selected to send for the training, for the bakery course training.
Okay.
So it's like that. So we should not delay.
Okay. So maybe we come back to a little bit in. I think maybe we talk about the curriculum in preschool. What are the things that they offer in preschool, and then primary, then we somehow we know a bit of the secondary already, which is very interesting. And I think a lot of kids will benefit from that. Yeah. So maybe we can talk a bit of the preschool, PPKI in preschool and PPKI in primary.
PPKI preschool, we follow the same preschool curriculum as we have in the mainstream. But it's a modified version. And now we're going to have the new curriculum. In 27, they were already started the new curriculum for the preschool. Still, it is based on the domains, which now we call tunjang. Then they started calling tunjang and all. Still the domain. They focus on physical
The
domain, social
cognitive, the
emotional,
physical.
cognitive domain,
Okay.
social
Yeah.
emotional language. We are confined to based on the domains. And the curriculum is basically a modified version of the mainstream preschool curriculum. I'm talking about the curriculum prasekolah kebangsaan, the one that we offer in the Malaysian preschool, which is under the primary school. We have preschools under the primary schools, right? So like that, we also have PPKI preschool. Okay. So this is basically the curriculum for preschool in PPKI. Plus, we also have additional subjects like pengurusan diri. Okay, pengurusan diri means self-help skills lah. Pengurusan diri in the preschool. So the pengurusan diri module will start right from preschool. And our preschool, we accept children from 4 years old, 4 to 5, 5 to 6. Okay, so 4 years old can come, 5 years old can come, 6 years old can come. And the number of students are definitely lower compared to the mainstream preschool. Mainstream preschool maximum you can take 25, one class. But in PPKI preschool, I think maximum is about not more than 10. Not more than 10. Same, one teacher, one PPM. Okay, same as the mainstream, but it's just that the mainstream, the number size is large, 25, maximum 25. But in the PPKI, only about 10. So some teachers, they also focus on toilet training and so on, depending on the age of the child. If 4 years old, then maybe they have got their program. Again, the same, the thematic approach, everything same in PPKI preschool. See?
Yeah.
So as they go to primary school, the syllabus is a bit different. Okay. In primary school, we focus on okay, in primary school, we focus on academic. In primary, they focus for literacy, reading, writing, counting. Primary, especially up to standard 1 to standard 3. If 4 to 6, then they will introduce 1 or 2 skill modules. That's all. Again, still, throughout the 6 years in primary, the focus is more on writing, reading, counting, to prepare them for the secondary actually. And then a lot of focus is also given for pengurusan diri. This pengurusan diri subject is a very important subject and core, I would say. In secondary also we have pengurusan diri, but the syllabus is a bit different.
Yeah, will be higher level of
Yes. And the
self-help.
sexual education start right from preschool.
Okay.
That of course we don't have a subject by itself. It is one component under pengurusan diri. As the level progress, the syllabus also targeted to teach the children on this sexual education, how to care for themselves, how to protect themselves. Secondary syllabus are all quite in detail about so many things.
Yeah.
And then we also have this. We have classes. Our classes are not based on category, not based on their whether they are autism or ADD or no. No. Okay, our classes students are streamed according to their functional level I mentioned just now.
Yes.
The kefungsian tinggi will go to mainstream. The kefungsian rendah and the kefungsian
function.
yes, high functioning. Moderate functioning, low functioning, moderate functioning, high functioning. The high functioning will go to inclusion. The low functioning and the moderate functioning. In between these two groups, we will shrink the classes. So the low functioning will be really, really low functioning. So for that, the syllabus that we have, we need to modify. The teachers will modify the syllabus according to the level of the children. When I say low functioning, they are basically children with behavioral issues, sensorial issues, okay, where their mental age and biological age, that is, the gap is too big. Too big. You remember I said we have got skill subjects, right? So the skill subjects, we will design for the low functioning one, for the moderate functioning one. That's how we work with. This practice is also in the primary school, where we stream the classes according to the functional level. Otherwise, it is very difficult for us to conduct lessons. You see, educating them based on their categories of disability it doesn't appear in the government setting.
So what I understand is
Sometimes we say autism techniques or ADHD technique. That we can't do. We can't do that in the PPKI programs. So therefore, we go based on their functional level.
Yeah.
Sorry, Kevin, I interrupted.
No. I mean, what I hear from your explanation, doctor, is that it's like the typical mainstream classes that we attended group the student based on, let's say, your exam, your result in the exam. So those do very well one, they are in the top class, and less well one in the between. But in the special education setting, it's group based on their behavioral challenge or the functionality, so that it's easier for the teacher to design the classes and the curriculum to conduct the class,
Correct.
also help them. And I think
Correct.
a lot of sense here. Yeah.
Yeah, correct.
Yeah, I would like to know a bit about the teacher and student ratio that is actually allocated in preschool, primary, and secondary. Do they have certain ratio, that fixed?
When I was still a teacher few years ago, now I'm not sure about the ratio. Probably they have, I don't know whether they have
Adjust?
the word, but it is 1 teacher to 7 students
Okay.
and with
Mm.
1 PPM, 1
Assistant
student
teacher,
assistant lah, assistant, not assistant teacher, student assistant.
student
The PPM
assistant.
is not a teacher.
PBM is not a teacher. So
She's not a
this person
teacher.
doesn't require to have the education background. Does it
They
mean?
can have degree, they can have diploma. They just apply to the government job like how any other people apply to government job, right? They apply to government job, they apply to become a PPM. And then if they get the job, then the government will send them for a course, crash course like that. And they come back to us lah. They come back to PPM. We also have in the preschool. Mainstream preschool also we have teacher, student assistant we call them. Pembantu pengurus murid.
Okay.
So 1 teacher, 7 students with 1 PPM.
Okay.
But depends, huh? But it is not that all the classes will get 1 PPM each. So how we manage the PPM is we give the low functioning class, we will give PPM, will give 1 PPM just for the class. The PPM will be there in the student assistant will be there in the class throughout the time, throughout the schooling timing lah. And one or the other 2 or 3 PPM, what we will do, we will rotate them for a moderate functioning, because the moderate functioning they don't need much assistance there. They are able to function by themselves. They can listen to the teacher. They can be a good teacher help. They can behave and so on. So that's
Yeah.
how we manage the resource that we have.
So we also know that there's a grade in. Oh, sorry, Xingyi, I
Okay,
can't.
it's okay. It's okay. You go ahead first.
Okay. Yeah. So I know that the number of special needs kids, especially autism kids, has increased tremendously for the past few years. The diagnosis is high. So what are the challenges that MOE is facing now? That if say they can't, the school cannot accommodate so many of them, how are they going to handle with this number of diagnosis?
Actually, they're working on it. More and more schools are opening up for this SEIP PPPI program. Every year, I'm not very sure how many, but every year at least 30 to 40 schools PPPI programs every now and then. Even in the parliament also there are budget allocated for PPKI programs. Numbers are raising. Yes, I know numbers are raising. It's just that we don't have an exact number. How many autism, how many ADD, how many ADHD, we don't have that number coming. Because one reason is our OKU card registration is not compulsory in Malaysia. You
Yeah.
see? So I believe there are many more out there. Okay. So the number that we have is the one who are joining the KPM alone. Okay. Again, we are not categorizing them. We don't get the number based on their category. So we get it like lump sum, special needs students. Okay. For this year, how many? Increase how many? At least every year, when I see the statistic, a few days ago, I saw the statistic. At least about 2000 to 2005 number of students are increasing every year. 2000 to 2005 enrollment, every year. So
That's why that's my biggest question is like how all this, the school can support. That is the question. But I know that
more
government is
teachers are
putting up
being trained.
more teachers, yeah.
And now, those who have done their degree in the private sector, but would like to become a teacher in the government, They are coming in as one-off under the one-off program. Our IPGs, we have 27 IPGs in Malaysia. We are
Sorry, what
actually
is
training
IPG?
them. IPG is the place that I work, like Institute of Teacher Education.
Oh, okay, okay.
Institute Perguruan Malaysia. So we
Oh,
are
okay, okay.
training them for the KPLI and the DPLI. DPLI means Diploma Pendidikan, KPLI Kursus Perguruan. So we are training them. So then they are getting into the schools. That is one laluan lah. The other is we have so many special education degree programs in the universities, in IPG especially. IPG degree programs, they are all after finish, they will get the government posting. So the numbers are also including numbers of teachers getting trained for special education are also increasing. Number of classes, they are also opening up. But I think we have come this far. We still have a long way to go, actually. I
Yes,
mean,
I
I'm happy that we
agree.
have come this far, but
Yeah,
we still have a long way to go.
agree.
We
So,
compare about 30
yeah,
years ago, 30 years ago, now, of course, we have come very far. Now, we are talking about inclusion now, whereas inclusion was not at all possible some years ago.
Yeah.
But now we are making it happen.
yes, because back then when we were in uni about 20 plus years ago, that's where all the institutions are like the school for the cerebral palsy, school for autism, school for Down syndrome, school for what. So it's all individual setting and it's not included together with the mainstream. Yeah. Okay.
And our teachers are
If you are
also
very
the ones who already graduated and got posted to school. They are also going for ongoing professional courses. From time to time, they are sent to update themselves. Not just, okay, sudah habis degree, that's it lah, I get into the school and start working. No, from time to time, now and then, they are also going for new, getting themselves updated because the challenges that we are having. Now you see the kind of students that we receive are no more mono disabilities. Okay, we are getting multiple disabilities, autism with this, autism with that, autism with speech difficulties, autism with dyslexia, all sorts we are receiving. So the challenges are greater, definitely, I would say.
Yeah. Kelvin, you want to say something?
just hear that, the number of increasing year to year, it's a big number. And therefore, we need more teachers who are equipped and trained. And I just want to say that, Doctor, your job is very important because you are the teacher for the teachers. And you have to, you don't work too hard because you have a big mission. So you need to learn to rest and take care of yourself as well.
Yeah,
She's going
balance
on
is
a
very
holiday soon.
important.
So maybe doctor, we can talk a little bit about when the parents, send the kids, what is the involvement looks like when they send the kids to, kindergarten all the way, primary and secondary. Yeah, would like to hear from you.
Parents, if you have the intention to send children not just to government school, lah, to school. We don't want our children to be staying back, isn't it? Right? Start as early as 4 years old, at least 4 years old. Students face challenges. Teachers also face challenges in school if the child is not toilet trained. Number one. Second, feeding by themselves. If not rice, at least eating bun by themselves, eating biscuits by themselves. It's two very important. It's two, toilet and feeding as early as 4 years old. And there should not be any kind of impression, oh, my child has autism, my child has this and that. I kasihan, I pity, I better help him to the maximum he can't do. Or this kind of, I would say this kind of perception in parents' mind, as he grow older, he will become better. Of course, he will become better as he grow older, only if you work with him. If you don't work
Yes.
with him, if you don't work with the child as soon as you can, the child will not get better. Naturally, like how we how we perceive to typical children. As they grow older, the children will become better. That's a different story. The typical children, they are typical. They receive information through their environment. They watch, they learn. Environment is a great model for them. You don't really need to teach so much to them. As they learn from peers. Their world is open for typical children. But for our special needs, the world is closed. They most of them are in their own world. So you need to stimulate them. You need to pull them out, you know, make them see the world. So if I would say there should not be any kind of kasian kind of thing in your mind. Don't do that. Start early. You can 3 years old, 4 years old. Don't until 6 years old, the child is still with pampers. We're going to have a big trouble when the child goes to standard 1. Okay? Standard 1 also still pampers. Standard 2 pampers. Until forever common, they will go to school with pampers. They are the one placed in the no functioning classes. And if we meet that term, that age group, that age, period,
The
very
intervention, right?
very difficult. You want your child to go to school. The school is not a place to babysit your child. School is a
No, that's
place to
recess, yeah.
educate your child. So for the school to educate your child, you also must help the school. To the least, prepare the child. Tingkah laku, behavior. Prepare your child to the maximum, especially independency. This is something very important, Kaman. Then, once the independency comes in, okay, or the behavior is conditioned, okay, automatically the academic skills will come in. See, you have taught the child to be independent, can go toilet by himself, can eat by himself. To a certain level, the behavior is also conditioned. Somehow conditioned. Then the child goes to school. It's plus minus. The teachers will help them. Then teachers will work on the fine motor skills, gross motor skills. Teachers will enhance the self-help skills the child already has. And teachers will work on it. The child goes to school happily. The child comes back to school happily, comes back home happily. And then the primary school falls in. And then the child goes to secondary school. So the preparation must start as early as possible. In early intervention, 2 to 3 years old, 4 years old maximum, 4 years old start. Making the child being independent. The third one, by 5 years old, okay, try to put the child to sleep on their own. Try to have a room for themselves, a bed for themselves, a separate toilet for themselves in that room. Trust me, that will really, really improve the independence of the child. Maximum Una, 6 years old. Don't sleep with the child in the same room. Parents, husband and wife. The child is in between, 6-year-old in between, or another separate, uh, you know, uh, bed in
Mattress.
the mattress or bed in the room. Next, it disturbs the parents' sleep. It also creates a lot of issues. So maximum 6 years old. Start putting the child, give him his own space. Okay?
Dr. Shah, you want to
Own
share
cupboard.
a little bit tips on how to encourage the kids sleep separately with the parents? What are some tips that you have
Maybe
used?
I can
I
share
think you have talked to
my
so many parents. Yeah.
I can share my experience lah. I also learned from many, many therapists. Okay, the journey wasn't that easy. Like what I said just now, Kevin said, I'm so busy, I'm this, I'm that. I think Kevin said that. I'm only busy, I'm only started to focus on my career now, Kevin. The beginning or the early years were not that easy. It was very, very difficult. I was just a normal teacher. Although I had a lot of interest and passion and ambition, but I had to sacrifice a lot just for the boy. See, that's the reason why actually, Kaman, I moved from KL to Ipoh. One reason is because my husband was working overseas. A lot of traveling. I couldn't handle the boy alone. In Ipoh, I had the support system. My parents were here, interventions, and the cost of the intervention were much cheaper in Ipoh compared to KL, and so many things lah. So the first 5 to 6 years, I would say, it was a very, very difficult period for me to accept the diagnosis, to shop around, go around, find whatever that is there under the sky. People suggest, I try, I do what I can, dedicate my time, my years just for the boy. Why? Because I don't know why I always had this in my mind. Probably because I was also a teacher and I was seeing children in the secondary school. I had this mind, no, no, no. I don't want my later age, my later years to be miserable if I don't train him now. I don't know why I always had that in my mind. Probably the students, the kind of students that I had in the secondary school, I was teaching that. Looking at them, probably I had that kind of, I must prepare him. I must do something so that he can be independent. He can do things by himself, things like that. So there was one therapist. She was a behavior therapist for my boy. She was the one who actually helped me to organize, to make things proper, to put things back into places. So what she did, she came to my house. She said, "Okay, mom, there's a room down there. It's an empty room. You set up the room now." Okay. By that time, he was 6 years old, and I had a second boy. The second boy was 3 years old. So pity the second boy also had to follow. There's no two different kind of uh, uh, you know uh, kind of parenting in the house. Both the same. So two beds in that room. Then that room had a attached bathroom, and then I gave them two separate cupboards and so on. So I tried 7 days. I had a difficult time, but the 8th day were really, really wonderful. The therapist told me you had to be very, very firm. Your hati must be very keras. Okay. Every night he will come and knock. I lock our master bedroom. Lock. I told my husband also we have to pull through this. Every night he will come and knock, 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 cry, mommy, 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 mommy. The first night was very difficult. Was hours, we also sit lying down inside, no sound. I very gently I said, "Hey, go back to your room, go and sleep, go back to your room, no, go and sleep." Then the second night was lesser a bit, like if the first night 2 hours, the second night was like 1 hour 50 minutes. The third night, the fourth night, I can still remember. By the 8th day, he just went into the room and slept. You see? And since then, I saw tremendous changes. That's why I keep insisting, I keep telling everyone, yes, you love your child, but tough love, you know, tough love. Trust me, if you can do all these things, your life will be very much easier, later, because we are growing old also. We are not getting younger. So when we are young, we can tolerate many things. As we grow older, we may not be able to tolerate many things. You see, we get frustrated, we get tired. So I feel when we are young, better put our heart and soul to train the children so that our life will be easier later. So I would still, the tips I would say, oh yes, good. You want your child to excel in your studies. You want your child to go to school. You want your child to be good in academic, achieve, and so on. Work here first. Work at the early stage first. Okay. Don't straight away talk about reading, writing, learning alphabet, numbers, campur, tola, bahagi. Don't straight away talk about all that. Don't straight away focus on the academic. Prepare the child, improve their domains, their developmental domains. Then they will do very well. So that's I can say some tips that I can give lah. And then also, if you decide to put them in inclusion, learn about the policies, because no one will come and advocate for you. You only have to advocate for your child. So in order to advocate for your child, you must have the knowledge. So what are the policies that you must learn by heart? Zero reject policy. Okay, you must learn by heart with zero reject policy. It is available PDF format in the internet. Parents can just download, read about it. Okay, read, understand, ask people if you don't understand, read about it. Secondly, there's another policy called SDK policy. Sukarelawan dalam kelas. SDK policy. Okay. Now, what is SDK policy? If parents would want to become a shadow aide in the government school under the SDK policy, they can make a request. But again, that policy is not a compulsory, it's not mandatory for the school to allow you to do so just because we have the policy. But the policy is actually, policy paves the way for you. If you are
Okay.
good at these two, you hafal already, you're very good at these two, you can talk to them.
Okay. Kevin, we let you to wrap up soon.
Okay. So thank you so much for sharing your story with us and all the insightful information, Dr. Shai. So you mentioned that the two policy that is very important for parents to integrate or know a lot better compared to when we are not sure. Because I think it's important because it helps us to understand what's our right. And when we know our right, then it helps us to really able to advocate for our child. And your tips for the parents is also very closely related to my own experience. I think as a parents, we all have a natural instinct to protect and to provide and to love our children. And so these instincts sometimes make us do the things that seems right in the moment. However, if we are able to look a little bit forward, a little bit to the next few years or in the future, we may then realize that by helping them too much today, while it seems right, it may not be the best thing we want for the future. And I hope that listeners who listen in and hear your story and your sharing can understand why sometimes we as parents, we need to toughen our heart and be clear why we need to take a pause to go against our instinct or impulse to help when it's actually very easy for us to help. And as a parents, we need to do the tough things, which is don't naturally respond by helping, but actually sometimes give them time and space to let them figure things out themselves. It's actually what we want for them also, because they need to learn to be independent. So we will also be putting up the two documents you mentioned, the SDK policy and also the zero rejection policy. Listener can download and read with it, sleep with it, and then remember and memorize that. And again, once again, thank you so much for your sharing, Dr. Shai. And we also hope to have you back again because when it comes to schooling option, is something that I think all the parents have a big question mark about, and we barely cover 1/3 of all the schooling options here, but we're only talking about preschool and a little bit of primary school. So the journey has still ongoing, right? So again, wish you take care and be safe. And to the listener, come back again for the next episode also. Thank you. Bye bye.
Bye.
Thank you.
Thank you.
Bye.